Hypoglycemia. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have a full-time nurse. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or available during field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is hypoglycemia. The objectives are for participants to be able to understand how to recognize high and low blood glucose symptoms, how to treat high and low blood glucose levels, how to reduce risk of high and low blood glucose levels, and short and long-term risks and complications. Let's review a few vocabulary terms related to hypoglycemia. Glucose is a simple sugar found in the blood. It is the body's main source of energy. The term glucose and sugar are commonly used interchangeably. The same for blood glucose and blood sugar. Hypoglycemia is a low level of glucose in the blood. Quick-acting glucose are foods that contain simple sugars that are used to raise blood sugar levels quickly during hypoglycemia. Glucose tablets or gel are special products that deliver a pre-measured amount of pure glucose. They are a fast-acting form of glucose used to counteract hypoglycemia. Carbohydrate. Carbohydrates are one of the three main classes of foods and source of energy for the body. Foods high in carbohydrates raise blood glucose levels. Glucagon. This is a hormone given nasally or by injection that raises the level of glucose in the blood. Hypoglycemia is a low level of glucose in the blood. The onset of hypoglycemia is sudden, usually mild, but will progress if not treated. Hypoglycemia may even progress to symptoms of unconsciousness and seizures, and if it's not treated, can lead to brain damage or death. The Diabetes Medical Management Plan, or DMMP, should specify signs and action steps for each student at each level of severity of hypoglycemia. Mild, moderate, or severe are the classifications of hypoglycemia. These classifications were updated in 2016 and are now commonly referred to levels 1, 2, or 3. While a hypoglycemia episode is an urgency, it need not become an emergency. Most hypoglycemic episodes are mild, with students responding to eating a quick-acting carbohydrate such as fruit juice or regular soda within 10 to 15 minutes. Recognizing early symptoms and always having access to appropriate foods are the surest way to prevent an emergency. Hypoglycemia is the greatest immediate danger to students with diabetes. Most often, students will be able to recognize and treat the early symptoms of hypoglycemia. Occasionally, however, a student might miss the early symptoms. When this happens, students can quickly get to a state where they cannot reliably help themselves. In this case, they are dependent on others to recognize that they are experiencing a low blood glucose level and also to know what to do to treat the low. Left untreated, hypoglycemia can lead to unconsciousness, seizures, and may be life-threatening. Hypoglycemia is one of the most frequent complications of diabetes. It can happen very suddenly and is not always preventable. Hypoglycemia can impair cognitive and motor functioning. Even a student who knows he or she needs to eat might not be able to problem solve how to get the food, or may not have the fine motor skills to screw off a juice or a soda lid. Some students may become combative, and hypoglycemia may be mistaken for misbehavior. Hypoglycemia, or lows, occur whenever there is too much insulin in the body for the amount of glucose. This imbalance can happen for three main reasons. Too much insulin has been administered, too little food has been eaten, extra or unplanned physical activity, illness, medications, and stress. A student may have gotten too little food for a variety of reasons. The student may not have finished a meal or a snack. The student may have overestimated the amount of carbohydrate in a food or a snack. Or a meal may have been delayed or skipped altogether. There are no restrictions on physical activity for students with diabetes. However, when students are more active than usual at insulin peak times, they may experience low blood glucose. The symptoms of hypoglycemia vary from one individual to another. Also, they may vary for one individual from one episode to another. The symptoms of mild to moderate hypoglycemia are the first alert that the body is in a state of sugar deficiency. Symptoms may include the following: extreme hunger, yawning, sleepiness, shakiness, irritability or frustration, changed behavior, weakness, extreme tiredness or fatigue, sweating, paleness, anxiety, dizzy or lightheadedness, dilated pupils, increased heart rate, restlessness, confusion, or sudden crying. Mild to moderate hypoglycemia can usually be treated easily and effectively. Most episodes of hypoglycemia that will occur in the school setting are of the mild type. However, if not treated promptly, a mild hypoglycemic reaction can quickly progress to a severe state or condition which may be characterized by severe cognitive impairment and will require assistance in treatment. Remember, onset and progression can happen very quickly. Each student will have his or her own set of symptoms that characterize hypoglycemia. These symptoms should be listed in the student's DMMP. The important thing to remember is that early recognition and intervention is the best strategy to prevent progression to more severe symptoms. Intervene properly when hypoglycemia is mild to moderate to prevent the progression to severe symptoms. The steps for intervening with each student will be outlined in his or her DMMP. General steps are as follows. First, verify the blood glucose check when available. Some students confuse low and high blood glucose symptoms. Students may have symptoms when their blood glucose level is dropping rapidly, so treatment must be immediately given. However, if no meter is available, treat for hypoglycemia on the spot. If untreated, low blood glucose may progress to more serious events. Never send a student with suspected low blood glucose anywhere alone. When in doubt, always treat for low blood sugar. The DMMP will specify treatment for each student. However, the treatment plans for many students will follow closely the rule of 15, as we'll consider in the next slide. The steps for the rule of 15 include: number 1, have the student eat or drink fast-acting carbohydrates around 15 grams. Number 2, check blood glucose 15 minutes after treatment. Number 3, repeat treatment of 15 grams of carbohydrates if the blood glucose levels remain low, and recheck at another 15 minutes. And lastly, if symptoms continue or blood glucose levels do not increase, call the parent or guardian as specified in the DMMP. Any quick-acting glucose can be used to treat hypoglycemia. Limit intake to 15 grams or the student will experience a high blood glucose later. The goal is to bring the blood glucose back to the target range. Remember, treatment may need to be repeated at about 15-minute intervals based on continued low test results or poor symptom response. Each treatment dose should be 15 grams unless otherwise stated in the student's DMMP. Examples of quick-acting forms of glucose include 4 ounces of fruit juice, 3 or 4 glucose tablets, 1 tube of glucose gel, 4 to 6 small hard candies, 1 to 2 tablespoons of honey, 6 ounces of regulus soda, 4 teaspoons of table sugar. Younger or very small students might be directed to take 8 grams of carbohydrates, or about half of the amounts listed on the slide. Please follow DMMP for individual student treatments. Severe hypoglycemia symptoms include inability to swallow, eat, or drink, unconsciousness, unresponsiveness, or convulsions. Procedures for intervening with severe hypoglycemia will be covered in more detail in another unit on glucagon administration. Remember, the steps for intervening with a specific student will always be outlined in his or her DMMP. This slide describes the general steps in intervention. Severe hypoglycemia is rare, but life-threatening if not treated promptly. Place the student on his or her side. Lift chin to keep the airway open. Provide glucagon if provided for in the student's DMMP. Never attempt to give food or put anything in the student's mouth. Identify someone to call 911 and then contact the parent and guardian. The student should respond to the glucagon within 10 to 20 minutes. Remain with the student until help arrives. When the student is awake and able to swallow, give juice or other quick-acting forms of glucose, followed by a snack while waiting for EMS. The student may become nauseated and vomit after glucagon is provided. The onset and progression of hypoglycemia happens quickly. Knowing and following the basics of prevention is vitally important to a student's health, learning capacity, safety, and feeling of security. Keep a quick-acting source of sugar with the student, always, especially during school hours, extracurricular activities, field trips, and exams. Always treat promptly at the onset of symptoms. Preventing high or low blood glucose levels is all about keeping the balance between insulin, food, and physical activity. Timing is very important in all aspects of diabetes management. We want all of our students to eat on time, to check their blood glucose on time, to have their physical activity on time and to also eat their snacks on time. Ensure that their insulin dosage is accurate and in accordance with the DMMP. The DMMP should specify what assistance, if any, is needed. The same kind of accuracy in dosing needs to happen with food as well. With younger students, this may mean supervising and monitoring what is actually being eaten. Picky eaters will need to be monitored. Nutritional information should be provided to students and/or parents or guardians for all school snacks and meals. Some students, especially picky eaters or unpredictable eaters, may be given insulin after eating. The time of insulin administration will be specified in the DMMP. Here are a few more preventative strategies. Changes in the timing of snacks, meals, or physical activity should only be made after consulting with a parent, guardian, or a healthcare provider. Monitor blood glucose variations on gym days. Pack an extra snack for the student, and an extra snack may be required a half hour before gym or during prolonged vigorous physical activity per the student's DMMP. A student should never be alone when low blood glucose is suspected. Do not over-rely or under-rely on the student with diabetes for management information. Consult the DMMP. Remember, many kids with diabetes seem like experts, but their expertise has limits, especially when they are low. A few practical implications for educators related to the prevention and/or intervention of hyper and hypoglycemia include: students with hyperglycemia or hypoglycemia often do not concentrate very well. Students may need to have information repeated. Students should also have adequate time for taking medications, checking blood glucose, and eating. During academic testing, students should be able to check their blood glucose before and during testing. Students should have access to food or drinks and restrooms during the testing period. Students should be excused from testing with an opportunity for retake later should a serious high or low blood glucose episodes occurs. Making the right choice is the easy choice. Eliminating barriers to diabetes include becoming familiar with and following the 504 plan, the DMMP, the IHP, and/or emergency care plans. Try to eliminate all barriers to snacking, blood glucose checks, access to water and bathrooms, and insulin administration. Avoid judgments based on individual blood glucose readings. Communicate with parent guardians and the school nurse.